Hello everyone, my name is Tom and I'd like to welcome you to ADO's August webinar. With August 1st being World Lung Cancer Day, we've prepared this in-depth presentation to provide more information on the symptoms, causes and treatment options for what is one of the most common cancers worldwide. Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you, Tom. I'm really excited to talk to you about lung cancer today. The first question that everyone's going to have when we're talking about lung cancer is, what do I need to watch out for? What are the symptoms of lung cancer? And here you can see a gentleman who is coughing. Cough is obviously the #1 symptom of most problems of the lung, but particularly lung cancer. But surprisingly, lung cancer can present in a variety of different ways, not just coughing. #1, spitting up blood, sometimes associated with the cough, but sometimes not. There are a lot of other symptoms that we're going to get to as we go through the webinar that you should look out for also and can sometimes be indicative of lung cancer. One thing that I do want to point out here at the beginning is that unlike a lot of other cancers, lung cancer has a lot of different types. For instance, in prostate cancer, there is generally one type of prostate cancer, and kidney cancer, there's 1 or 2 types of kidney cancer. But in lung cancer, there are at least 4 different types of lung cancer, each that behave very differently from each other, that you can be diagnosed with. The main types are small cell, non-small cell, there was some unique thought put into that name, adenocarcinoma of the lung, and squamous cell carcinoma of the lung. Now, what causes lung cancer is something that I'm sure all of you also want to know, and we'll go on to the next slide to see that. So clearly, the #1 cause of lung cancer is smoking. Up to 80 or 90% of lung cancers can be attributed to smoking, either direct smoking or secondhand smoke, if, for instance, you're a child and grew up in a smoking house, or if you're a spouse and your spouse smoked. But up to 10 to 20% of lung cancers are found in people without a smoking or a secondhand smoking history. And in fact, one of those types of lung cancers that I was just talking about, adenocarcinoma, is felt to be much less likely to be caused by smoking than by other factors. So what are some of these other factors? The main second cause of lung cancer after smoking is radon. Radon is an invisible gas that is released by radioactive materials found in the ground and can permeate into houses, especially houses that are built with basements. What do we do to make sure we don't have a radon-infected house? Well, radon is particularly found in the Midwest and extending into the Plains states in the United States. So if you do have a house that particularly in that area, then you can get radon tested. In fact, in parts of the country, it is a necessary part of getting a building permit for your house is to show a radon test. There are a lot of things that you can do if you feel or if you discover that your house has radon in it. And it's a gas that gets diffused, spread away very easily. So sometimes all you have to do is put in a fan if your house is found to have higher levels of radon, and that can dissipate the radon very effectively and prevent the hazards such as the risk of lung cancer. The other way that people can get exposed to chemicals that can lead to lung cancer is occupational. And again, we're going to talk more about this later, but there are some chemicals that are possible to breathe in on certain jobs that do predispose you to developing certain types of lung cancer as well. So how do we figure out if you have lung cancer? The main way that we find lung cancers is on chest x-rays, and we're going to see a normal chest x-ray on the next slide. So this is just a teaching exercise here, so I can show you what a normal chest x-ray is so that later on when I show you other pictures, you can appreciate the difference. This is what the chest of a healthy person looks like. You can see a bunch of white kind of light stripes throughout the picture. Those are bones, and in particular the ones that are going through the black area, those are your ribs. The black to gray area that predominates most of the center of the slide are your lungs. On a chest x-ray, air appears as black, and things that reflect x-rays, such as bone and muscle, appear white. You can also see kind of a bulbous feature towards the center to lower center of the screen. That's your heart. But the most important area to look at are those black with white striped areas. There's one on the left of the picture and one on the right of the picture. Those are your two lungs. Since we are looking at this chest x-ray as if we are looking at a person, the right side of the screen is the left part of the patient, and the left side of the screen is the right side of the patient. To guarantee this, most x-ray places will put a little marker on the left side of the patient, and you can see that in the upper right corner of the picture as an L. That's to signify that, in fact, this was filmed looking at the patient, so that, again, the right side is the left side of the patient. Here you can see someone who has a fairly normal chest x-ray except for one problem. Can you find it? You probably can, because it's in that black box over again on the left side of the patient. It appears to be a circular white area that was not seen on the previous chest x-ray. This is indicative of a mass, potentially lung cancer, in the lungs. The big problem with chest x-rays is that they don't pick up masses, including lung cancer, until they are at least half of a centimeter, which is about a quarter inch across. Because of that, chest x-rays are really bad screening tests for lung cancer. I have a lot of smokers in my practice who say, well, can I get a chest x-ray to make sure I have lung cancer? And the answer is no, because by the time you find a lung cancer by chest x-ray, the vast majority of the time, it is too late to do anything about it surgically. Usually by the time a cancer is big enough to be seen on a chest x-ray, it is already metastasized or spread, and cutting it out becomes impossible. The better screening test is a CAT scan. A CAT scan can pick up very, very small lesions or spots in the lungs before they reach the size necessary to break off into little pieces and spread, which is how cancer generally kills people. So if you are a smoker or are at high risk of developing lung cancer, the American Preventative Services Task Force has come up with recommendations. Because people generally don't get lung cancer until later in life, the current recommendations are that if you are between the ages of 55 and 80 and have a 30-pack year smoking history, which I'll explain in a second, and have smoked within the last 15 years, then you should every year get a low-dose radiation CAT scan, because we don't want to give you all of the radiation of a regular CAT scan. That actually can increase your chance of getting lung cancer. But a low-dose CAT scan designed just to pick up early lung cancer spots. Obviously, if you're before 55, you're generally thought to be too young to get the benefit of the CAT scan. And once you get over 80, it is presumed that you're probably too old to make the treatment associated with lung cancer worthwhile, and they have recommended not doing the screening test beyond age 80. Now, I said you have to have a 30-pack year history of smoking. What does that mean? To find your pack year number, you multiply the number of packs that you smoke in a day times the number of years you are a smoker for. So if, for instance, you smoke 2 packs a day and have smoked for 10 years, then you have a 20-pack year history. To get to a 30-pack year history, you have to smoke a pack a day for 30 years or half a pack a day for 60 years, and you can figure out the math beyond that. Again, because your risk goes down once you have not smoked for 5 years, and it goes way down if you don't smoke past 15 years, even if you were a heavy smoker and let's say from age 20 to 50, you smoked a pack a day. Once you get to 65, if you quit at age 50, your risk has gone down to the baseline or normal healthy person's level, and you don't need to continue the CAT scans. What do green beans wrapped in cellophane have to do with lung cancer? Well, the point here is that the green beans are your lungs, and your lungs, just like these green beans, are wrapped in a protective sheet of essentially clear plastic cellophane. It's called the pleura. The pleura wraps the lungs, and when you take a deep breath in, the pleura helps pull the lungs open so that you can take a deep breath in better. The problem is the pleura can sometimes develop lung-type cancers of its own that are frequently referred to as lung cancers. We'll get back to the pleura in a couple of minutes. Here is a picture of some attic insulation. This is to get back to, remember when I was talking about other risk factors of lung cancer, particularly related to your job? Well, insulation, not so much insulation anymore, but insulation in the past is one of the leading causes of this type of pleura-based lung cancer. Cancer that starts in the lining of your lung rather than inside the lung itself. Asbestos, I'm sure all of you have heard about asbestos. Even a little bit of asbestos from old-fashioned insulation tends to get into the lungs, through the lungs, and irritates the pleura and can lead to lung cancer. Besides, for people who put in insulation back when asbestos was allowed in insulation, shipbuilders are at tremendous risk of asbestos-related lung and lung lining cancer. Shipbuilders typically used lots of asbestos to insulate the hulls of ships and even in the hull building process. And because of that, people who worked in shipbuilding are at high risk of having been exposed to the insulation and the blown in aerosolized type of asbestos. So here you see a picture of another chest x-ray with a big black circle. Clearly here we're not dealing with a spot like we were on the last one. Here we are dealing with a problem of that pleura or lining. The right part of the chest x-ray, which is in the left part of the picture, again looks mostly like a black area with some white stripes. There does appear to be some other hazy whiteness there. That's because this is a picture of a female, and what you're seeing is a little bit of a shadow from a woman's breast. But on the left, clearly things don't look right. That lining, which on the other side tends to kind of come down along the edge of the ribs off to the side, now, if you can imagine, tends to be thicker and whiter and bends inwards towards the lung. And as a result, that black area that you should see on the bottom of the lung is completely gone, and you only see kind of that black air area in the upper 2/3 of the lung. This is mesothelioma, that type of lung cancer that I was referring to that comes from asbestos and affects the lining or pleura of the lung. It is a particularly dangerous type of lung cancer, a particularly uncurable type of lung cancer that, again, is a result of asbestos exposure. Unlike smoking, where we say most but not all types of lung cancer are caused by smoking, it is thought that every single case of mesothelioma is probably the result of at least some asbestos exposure, known or unknown, in the person's life. So you have these lung cancers. How do lung cancers kill? Because lung cancer is the leading cause of cancer death in the United States. And on the next slide, we will see one way in which lung cancers can kill. Here you have a spot of something in a otherwise healthy CAT scan of a brain. This is what your brain looks like if you sliced your brain like a loaf of bread. But it's very, very clear with that arrow pointing there that there's a big white spot that, let me tell you, should not be there. This is one way that lung cancer can kill. Lung cancer, the most common types of lung cancer especially, really like to spread to the brain, where they can obviously cause thinking problems as well as seizures. Other areas that lung cancer likes to spread to is the bones, and in particular, they can get into the bone marrow, which is where you make cells that fight infections, and they can affect your immune system, and people with lung cancer are particularly prone to getting infections. Finally, lung cancer is a very fast growing cancer, and the faster growing a cancer is, the more energy it needs to grow. Because it needs so much energy, it uses up a lot of your food supply. So when you eat, what you're doing is feeding the cancer. The cancer will grow while the rest of you shrinks, and people with lung cancer tend to lose a lot of weight and as a result, have very low energy because lung cancer can sap all of their energy as well, which is another thing that will speed someone who is otherwise ill along their way to, unfortunately, death in many cases of lung cancer. But lung cancer just doesn't do all of its evils by spreading places. Some types of lung cancers have some very special things that they do as well. So this is just a picture of a salt shaker. You would say, what can the salt shaker have to do with it? Well, small cell lung cancer, one of the types that we talked about at the beginning and one of the most common types of lung cancer, can be very unusual in that it can make hormones. Now, it's a characteristic of many types of cancer that they tend to not make the hormones associated with the parts of the body that they come from. For instance, if you have thyroid cancer, it doesn't usually actually make working thyroid hormone. And if you have prostate cancer, it doesn't usually make the normal chemicals that a prostate makes. Well, lung cancer, particularly small cell lung cancer, tends to not follow those rules and not only makes the chemicals that the lung can normally make, but in fact can make excessive hormones. For instance, small cell lung cancer is known to make a chemical called ADH. You don't really need to know what ADH means, except that what it does is it works on the kidneys to lower the level of salt, hence the salt shaker, in your body. As a result, people with certain types of lung cancer present to the doctor because they feel really weak and are found to have very, very low levels of salt. And this can be one of the ways that lung cancer is detected, by unexplained, excessively low salt levels. By going to your bones and through other chemicals that small cell lung cancer can make, it can also raise your calcium level. Great, elevated calcium. A lot of people take calcium supplements. Isn't that a good thing? For some people, yes. But for most people, the chemicals made by small cell lung cancer can raise your calcium to dangerous levels, to the point that, again, you can get confused and it can cause calcium stones to form, especially in your kidneys, leading to kidney stones. So what can you do to prevent lung cancer, and what can you do if you do have lung cancer? Well, in terms of preventing lung cancer, we've gone through some of the things. Obviously, it is very important not to smoke, and if you are a smoker, stop. And if you have smoked a lot, get the screening tests we talked about. If you live in a part of the country where radon is common, make sure your house, especially your basement, gets checked for radon levels. If you do get lung cancer, unfortunately, or if lung cancer is picked up on your screening test, what can you do? Well, if it is picked up on your screening CAT scan, it may still be possible to cut the lung cancer out and be cured. But unfortunately, by the time you find it by one of these other ways, low salt levels, picked up on a chest x-ray that you had for a cough, most of the time surgery is no longer an option. Most of the time, the cancer is too far advanced and has likely already spread to other places to make surgery a good option. In that case, you need chemotherapy, and fortunately, there are a lot of new immune therapies out specifically for lung cancer, which you can use your body's own immune system to fight cancers. And these have been shown to be very effective at lengthening the amount of time you have to live, if not completely curing lung cancer. All right, from there, we're going to go along and tell how Activ Doctors can work for you in terms of diagnosing, screening for, and preventing lung cancer. So Activ Doctors Online has 3 very effective elements that we use to help our clients. First, we have our personal health records. With Activ Doctors Online's personal health records, you can store all of your medical information from all of your doctors, not just one doctor at a time, like many doctors' PHR systems have. We can actually store images, including your chest x-rays, including your CAT scans. So if you go from doctor to doctor, or if you move, or if you're traveling, we'll know what your last chest x-ray or your last CT looked like, which is very, very helpful in determining whether the one you're having now actually shows a problem or scar tissue or something else. With our second medical opinions, you can get an opinion from one of our top specialists from around the United States or around the world. Lung cancer can be a very, very serious diagnosis, and with all the recent advances that are being made, you want to make sure that you're getting the best, most up-to-date advice. And by putting you in touch through Activ Doctors Online Second Medical Opinion with one of our specialists, we can make sure that that happens. Finally, with our e-consultations, we can put you in touch with your own doctor if both of you are members of Activ Doctors Online, and make sure that you're able to have virtual meetings with them, which might be able to save you time and getting an appointment with your doctor and work for both of you. With that, I'm going to turn it back over to Tom, who will go through how to get started with Activ Doctors Online.
Well, thank you, Dr. Zahalsky, for another excellent presentation. Here at Activ Doctors, our vision is to reinvent healthcare by providing user-friendly mobile health solutions that allow people all over the world to live healthier, safer, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even their lives. We hope you've enjoyed today's presentation, and we invite you to start a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.